Hi everyone, I'm Joseph Leung, and I'm an adult endocrinologist affiliated with UBC and Vancouver General Hospital. In this video, I'll be talking about CGM and an introduction to continuous glucose monitors. So first off, we're going to start off with a case. This is a 43-year-old female with type 1 diabetes, and this is the ambulatory glucose profile that is uploaded. She says that she has dinner at 5:30 p.m. and she does not eat a bedtime snack. She sleeps at 9 p.m. Which of the following Omnipod settings would be the most appropriate? A, decrease the basal rate at midnight. B, eat a bedtime snack. C, increase the carb ratio at midnight. D, increase the insulin sensitivity factor at midnight. And E, increase the active insulin time. So you can pause this video, think about this for a moment, and then you can continue on. So in this talk, I'll be talking about the different continuous glucose monitors, or CGMs, that are available in British Columbia. And then I'll be talking about the features of an ambulatory glucose profile briefly. And then lastly, just a slide on the internationally recognized CGM targets for individuals living with diabetes. So first of all, what is a glucose monitor or a continuous glucose monitor? Well, it is a device that measures the glucose in the interstitial fluid. So I think one of the things that I want to make a distinction about here is that when we check a capillary blood sugar, this is reflective of what the blood sugar is at that very moment. A continuous glucose monitor is measuring the interstitial fluid. That's the space between the cells. And there is maybe a little bit of a time lag, somewhere in the neighborhood of 5 to 10 minute time lag between what is in the blood and what is in the interstitial fluid. So when an individual is having a low blood sugar, for example, it is more accurate to check the capillary blood sugar at that very moment to know what is happening, as the interstitial fluid may have that time lag, as I mentioned. But overall, in general, that interstitial fluid does correlate very well with what is going on in the bloodstream. There's a couple other terms that you may also hear about. So flash glucose monitor was a previously used term when we had the Freestyle Libre 1 around. And in that situation, Freestyle Libre 1, you actually needed to scan the sensor on the arm, and the data would last in the sensor only for 8 hours. So beyond the 8 hours, if you didn't scan, all that data would be lost. With Freestyle Libre 2 and the upgraded Freestyle Libre 2, it is no longer a flash glucose monitor. There isn't this function anymore. And Freestyle Libre 2 is a continuous glucose monitor. It communicates directly with the receiving device or a smartphone, for example, and all the glucose goes directly there. And so in the past, we kind of used this term continuous glucose monitor as an umbrella term that included flash glucose monitors as well, perhaps. But these days, we do understand that all of the commercially available glucose monitors in BC are continuous glucose monitors. Within that, within this terminology, you may also see RT-CGM and IS-CGM, this especially in the research literature. So RT-CGM stands for real-time CGM, and that's a true continuous glucose monitor, whereas IS-CGM, that is synonymous with the flash glucose monitor. So if you ever see these terms, that's what they mean. So in terms of the CGMs that are available in BC, we have Dexcom. So there's both Dexcom G6 and Dexcom G7 that are covered by pharmacare. There's the Freestyle Libre 2, and that is also covered by pharmacare. And then lastly, we have the Medtronic Guardian 4, which is not covered by pharmacare. This is the special authority form that is needed in order for Dexcom G6, G7, and Freestyle Libre 3 to be covered. Of course, many of us are using the e-forms now, so we don't fill out these paper forms anymore. But one of the major criteria in order for an individual to qualify for pharmacare coverage for these continuous glucose monitors is that they must be using multiple daily injections of insulin or an insulin pump. So if they're not on insulin or if they're only using once a day basal insulin, for example, they will not cover through pharmacare. Some people have extended health coverage though, so that might cover it, or the extended health coverage might cover the Medtronic sensors as well, which are not covered by pharmacare. So first off, Dexcom G6 and G7. So this is the G6 here, and there can be connectivity with smartphone, smartwatches, and also this is the Dexcom receiver device here for individuals with a phone that is not compatible with Dexcom, for example. There is an auto applicator, so this is what it looks like here for the Dexcom G6 anyway. And there are customizable alerts. There's lots of connectivity. Calibration is not required, but you can calibrate with a capillary blood glucose if you'd like. And then pharmacare will cover, as I mentioned in that last slide. This is that what I like to call a filament that goes under the skin, and this is what is measuring that interstitial fluid glucose level. This purple bit here is the sensor. So this whole thing, including that filament, is a sensor. And then this gray bit is the transmitter. So on the Dexcom G6, the sensor needs to be changed every 10 days and the transmitter needs to be changed every 90 days. Whereas for the Dexcom G7, I don't have a picture of it here, but there is no separate sensor and transmitter. That's all just together in this one button that needs to be changed every 10 days. Next up is the Freestyle Libre 2. This one can be covered by special authority as well, as I mentioned. There is this sensor applicator over here. There are high and low alarms. You can use the phone as a reader, or you can also use one of these reader devices if a patient prefers. The Freestyle Libre 1, which was just a flash glucose monitor, if you are using the sensor or the reader for it, sorry, there's this black color to the reader, whereas if you see a blue reader like this is the reader for the Freestyle Libre 2. The sensors are not interchangeable between the Freestyle Libre 1 and the Freestyle Libre 2. We hear that the Freestyle Libre 3 may be coming very shortly, perhaps in a few months. And this is the little filament that sits under the skin, measuring the interstitial fluid. And then we have the Medtronic Guardian 4. So pictured here is the Guardian 4 sensor. I believe this one is the Guardian 3, but as you can see, they look very similar. So this is a continuous glucose monitor as well. There's an auto applicator. This device over here is the charger for the transmitter, and this sensor can connect with Medtronic insulin pumps. For the Medtronic Guardian 4, you just need to calibrate once to get into auto mode, and there is no need to calibrate on a regular basis. So here's a summary chart of these different continuous glucose monitors, and I've just kind of compared and contrasted the different brands that are available in British Columbia. So if you are seeing a patient, for example, on the wards who is using a continuous glucose monitor, you want to ask them about how long they've been using it, which brand they're using, for example. But here's some other things that you might want to try to look for if you're able to. So first is the time in target. Next is average glucose. Then you might want to also look for the glucose management indicator, or GMI. This basically means estimated A1C based on the glucose data from the last couple of weeks. So we're trying to move away from the term estimated A1C because it's not really a true A1C. A1C is really that 90-day average based on the glycated hemoglobin, whereas GMI it's using the sensor data. So these terms are basically refer to the same thing, but we're trying to use the term GM, not GMI now. And then if time permits, especially in an outpatient setting, you want to review the CGM, upload the whole ambulatory glucose profile, which is exactly what we're going to talk about next. So this is what's known as an ambulatory glucose profile, or AGP for short. And so one of the features of the AGP that you will see is the time in range. So for this particular individual, you can see that they have 56% of their time in range. And you can see a time below range as well. So there's time low and time very low. And then there's the time that is above range. So the time high and time very high. So these are all good things to review and record in their chart. There's the glucose metrics, the average glucose and the GMI that I mentioned. And a GMI of less than 7 percent. So that's, basically what we're saying is kind of an estimated A1C of less than 7%. That's equivalent to a time in range or time in target of 70% or above. There's the coefficient of variation. So this tells us how tightly the blood sugar readings wrap around the mean blood sugar readings. And the goal here is less than 36%. And there's also this time that the CGM is active. So this tells you how much of the time the patient is wearing their CGM device. And then here at the bottom, we have what they call here the ambulatory glucose profile. That term AGP can refer both to this graph as well as to the whole thing. And this AGP here shows their average blood sugar as well as the standard deviations around this for the whole 24-hour period. So you can see that, for example, for this particular patient, the blood sugars are rising overnight. So this is what might guide your history taking. You might ask them, are you having a snack at about 1 a.m.? Is that what's driving this blood sugar rise? Or is it because their basal insulin, whether by insulin injection or insulin pump, is inadequate? So you might want to ask about that. And then the blood sugars come back down into target at around 11 a.m. noon. And then towards the late afternoon and evening, we see that there is a rise in those blood sugars once again. So this can really help to drive your clinical history taking as well as the management and the dose adjustments for this individual's insulin. Lastly, I want to describe the international targets for CGM. So in most individuals with type 1 diabetes and also type 2 diabetes, we are targeting a time in range or time in target of greater than 70%. And that target range is defined as 3.9 to 10 millimoles. We want to see a time below range of less than 5%, especially time low of less than 4 and time very low less than 1%. And then the time high should be less than 25% or so. And you can see the definitions of that being greater than 10.0 millimoles. There are some other special situations here in older adults, in those with type 1 diabetes and who are pregnant, and then those who have gestational diabetes or type 2 diabetes and who are pregnant. Some of our targets are also listed from this paper from Diabetes Care. So I'm going to go back to our case here, and this particular printout is from what looks like the Freestyle Libre. So she has a time in range of 49%, but she has quite a significant time low as well. In total, 12% time low. I mean, when we look at the AGP here, we see that a lot of these lows are overnight. And when we look at this daily graph here, we see indeed a lot of these occur at 1, 2, 3 a.m. And they have type 1 diabetes. They don't eat at all after 9 p.m. So presumably these lows are due to the basal insulin. And so the correct thing to do in this situation would be to reduce the basal rate starting at midnight to hopefully get these blood sugars up. And then after that, we can also think about maybe strengthening the carb ratio and or ISF in the daytime to help with these daytime blood sugars come down into the target as well. So in this talk, we've gone through different CGMs that are available. We've discussed an AGP as well as the CGM targets. Thank you very much.